Hello and welcome to My Favorite Thing, where today I will be discussing personality and substance use. So what shapes personality? There are actually many different theories which include parent-child relationships, biological influences, environmental impact, and operant conditioning. So first we'll talk about parent-child relationships, which have a lot to do with social factors. Positive parenting is associated with extroversion, agreeableness, openness, and show lower levels of neuroticism. Next we have biological influences. This approach has a lot to do with the wiring of our brain and the identified pathways within our brain that are associated with the development of personality. Environmental impact. Studies also show that the environment affects 50 to 75% of your personality. This includes parenting and the conditions by which one is surrounded. So these are multifaceted and sometimes very complex. Operant conditioning can also promote the development of more complex behaviors through a process called shaping. Shaping involves the reinforcement of successive approximations of complex target behaviors. Borderline personality disorder and antisocial personality disorder are also particularly found to be associated with substance use disorders. Studies suggest that the overall prevalence of these personality disorders affect only 10 to 14% of the normal population and affects 35 to almost 73% of patients in addiction treatment. Common symptoms between substance use disorders and personality disorders include impulsive behavior, extreme emotions, distorted self-image, intense unstable relationships, and other co-occurring disorders such as anxiety and depression. Why do people use substances? Some reasons for use of drugs and alcohol include relief of tension and stress, existential boredom, self-medication for chronic pain or undiagnosed mental health disorders, genetics, family history and predispositions, trauma, including physical, mental, emotional, and sexual, social influences, and peer pressure as well. Researchers believe several factors contribute to a person's development of BPD. The first one is genetics. BPD often runs in families, leading scientists to believe genetics play a role in the disorder. Certain inherited temperaments or personality traits such as aggression may also increase BPD risk when combined with environmental factors. Neurotransmitters. Altered functioning of neurotransmitters in the brain, specifically serotonin, dopamine, and noradrenaline, may also make a person more likely to develop borderline personality disorder. These neurotransmitters are responsible for the regulation of certain emotions and urges. Neurobiology. Studies found that certain regions of the brain are often smaller or more active in those with borderline personality disorder. The three areas in particular are the amygdala, the hippocampus, and the orbital frontal cortex. Environmental factors. There are several factors that seem to be common among those with borderline personality disorder. These factors include childhood trauma and growing up in an unstable family situation or around individuals with mental disorders or substance use problems. Can personality studies help future substance use prevention? The answer is yes. We can better predict who is more susceptible to use and abuse by better understanding personality and what influences its development. That is all I have for you, so thank you for watching and please like and share.
Mama.
Hello and welcome to My Favorite Thing.